properly donning and doffing PPE.
Donning of personal protective equipment. First, we need to conduct hand rub. Applying an antiseptic hand rub to reduce or inhibit the growth of microorganisms. Put on gown. Fully cover your torso from your neck to knees and your arms to the end of your wrist, then tie at the back. The gown should be large enough to allow unrestricted movement without gapping. Fasten at the back of the neck and waist. Put on surgical mask of P2 N5 respiration. Secure the ties or elastic bands at the middle of the head and neck. Fit flexible band to the nose bridge. Fit mask to face and below the chin. Fit check respirator according to manufacturer instruction. Put on protective eyewear or face shield. Place over eye space and adjust to fit. Put on gloves. Extend the gloves to cover the wrist of the gown.
Why it is important to do a proper donning and doffing PPE. To reducing contamination of healthcare workers caring for patients with transmissible infectious diseases. Removing doffing personal protective equipment.
Hi guys, you're going to learn the process of doffing. First, you remove the gloves, the right one, the left one, properly. After removing the gloves, you untie the gown from the back side. After untying the gown, you remove it carefully. You make sure the gown doesn't touch your uniform, because already the gown is contaminated, the gown is dirty, the gown has got germs. So you make sure you fold it properly. After folding it, you put it in the trash. After putting it in the trash, you remove the hair net, because it's already also contaminated. After removing the hairnet, you remove the face shield. Hi guys, after removing your face shield, you're now going to wash the hands. Practice hand hygiene. First you wet your hands, after that you get soap, you rub it in the circular motion. You wash also the back side of your fingers properly. After that you wash also the tips of your fingernails so that the germs in the nails to get rid of. After that you interlock your hands, you scrub properly. You also scrub the thumbs, the right one and the left one properly. You make sure your hands are clean. After that you rinse your hands with clean water properly. After cleansing your hands with clean water, you get a dry towel or tissue. You dry your fingers and your hands properly. After that you stop the running water and you throw the tissue in the trash. After throwing the tissue in the trash, you remove your face mask. You also throw it in the trash. Good to go. Clean your hands using sanitizer. After you also clean the back of your hands, the fingertips, the left one and the right one. After you interlock your fingers properly, you also clean your thumbs properly, the right one. After, you're good to go. Thank you.
Remember, personal protective equipment or PPE is a protective gear used to safeguard the health of frontline workers by minimizing the exposure to infection. Components of PPE include face shield, mask, gloves, coverall, gown, etc.